Hello and welcome to It's Your Case, brought to you by vetct.com. I'm Lucy Meehan, your radiologist on call for this case. Today's example is a 17-year-old warmblood gelding with a chronic right hind limb lameness. Once you've reviewed your radiographs using your systematic approach, then you're ready to watch this video. I'm going to highlight the most pertinent findings of the tarsal joints in this case. So we're going to start by looking at the images that we have on the screen. We've got a dorsoplantar, a dorsolateral plantar medial oblique, a lateromedial and a dorsomedial plantarolateral oblique view of the hock. These are relatively well positioned. If I'm being super picky, they're centered a little bit higher than I would like, so we've got quite a lot of tibia. I prefer to have a bit more metatarsus, but otherwise I think they're very nice views. Our lateromedial we can see clearly through our talocalcaneal joint and clearly through our proximal intertarsal joint, and that's really important to know that we are lateromedial to the horse. So if we start by looking at what pathology we can see, we'll start looking at the dorsolateral view, because I think that probably is the most severely affected. We can see that we're nicely through our proximal intertarsal joint here, but when we look at our distal intertarsal joint, there's no real continuous defined joint space. We've got areas of lucency here, here and here. We've got a bit of a joint space here at the plantarolateral aspect, but certainly dorsomedially we really don't have much in the way of joint space. We have lost the normal appearance of the intertarsal fossa here. There's a little bit on the report about that and a comparison of a normal. This contour of the dorsal aspect of the distal intertarsal joint is abnormal. That's bowing out more than I would expect, so that's likely to be periarticular osteophytes forming a bridge. So the dorsodistal aspect of the central tarsal bone and the dorsoproximal aspect of the third tarsal bone form a bridging type osteophyte there. And then if we look at our tarsometatarsal joint, although we can see clearly through that joint, we have got an osteophyte here on the dorsomedial aspect of the tarsometatarsal joint. If we look at our lateromedial, just to confirm what we're seeing, we can see we've got fairly smooth, well-defined, but not quite normal bones. That's periosteal new bone there. We have got a very large osteophyte, or moderately sized osteophyte, just here at the dorsal aspect of the proximal aspect of the third tarsal bone. That's a really important finding, and that can sometimes be a red herring. If you haven't got any other evidence of osteoarthritis in the distal tarsal joint, so the distal intertarsal or the tarsometatarsal joint, it's very important not to overinterpret an osteophyte in that region. That's primarily because there's been some work that's shown that can actually be an enthesiophyte of the tendon of insertion of the tibialis cranialis or the peroneus tertius. So although we have got an osteophyte there, that alone doesn't give us a diagnosis of tarsometatarsal joint osteoarthritis, and certainly if we haven't got any other findings, so we have got some slight irregularity of the joint space here, and we can see periarticular new bones, so I'm more confident that that is osteoarthritis in this case rather than an enthesiopathy. If we look at our dorsoplantar view, we can see that again we're straight through the proximal intertarsal and tarsometatarsal joints. That's really important because slight image obliquity, slight obliquity of the X-ray beam can cause us to be off instance to those joints, and if you can't see through any of the proximal intertarsal, distal intertarsal or tarsometatarsal joints, I will be much less keen to give a diagnosis of ankylosis of the joint than if we can see very well through the proximal intertarsal and the tarsometatarsal joint, but not through the distal intertarsal. So that's something to look out for, because you can sometimes be fooled by a slightly poorly angled X-ray. Again, if we look at our distal intertarsal joint, we can follow that down here. Again, we've got some lucencies here. We can follow that, but on its medial aspect here, it becomes very, very difficult to follow. If we look at our subchondral bone plate, so our distal subchondral bone plate of the central tarsal bone, you can see this becomes much, much thicker in the medial region, and you can see medially of the third tarsal bone as well. That becomes much thicker at that point. So we've got some subchondral bone sclerosis here in this medial aspect. So all in all, in this horse, we have a diagnosis of osteoarthritis of the distal intertarsal joint and the tarsal metatarsal joint, with partial ankylosis of the distal intertarsal joint. And that would fit with a chronic lameness in this case. I hope that's answered any questions that you had on this case. Be sure to review the full report. There's some handy references in there and some reference images. Thank you for listening. Do remember, it is your case, so if you have any questions, please post those on social media and we'll do our best to get back to you.